So today we're going to look at standing, and we're going to look at how your child learns to stand and what you can do to help your child achieve standing. So looking very early on at early standing, newborn babies actually have a couple of reflexes that really help with the development of standing, get them used to standing. So the first one is the stepping reflex. So when you hold a newborn baby up, you'll see that they automatically just step their legs. So you're not like this, and you'll just see a stepping pattern happening. Also, there is the positive support reaction where you put a young baby down on a surface and they will push back against that surface by extending their legs and pushing through their feet, their knees, their hips. Just a momentary push, but those two reflexes are there very early on and can be used to help standing. So moving on a little bit, your child will first learn to stand with your help. When you're holding them on your lap or holding them so their feet are on the floor, they will start to push up and take weight through that surface beneath them. But they're very much reliant at this stage on your support, and you'll inadvertently be doing this with them without realising. So you might be holding on your lap, their feet come in contact with you and they will push up through their legs and you'll be there supporting, chatting without realising. So just taking a little bit of weight through their legs. But they're very reliant on you to start with to have this support around their chest, lots and lots of support. Now we've talked about early development on backs and tummies. And we talked about how when children are lying on their backs, they've got gravity acting down on them, which is helping to open up their hip joints, because when they're very little, they're all a little curled up ball generally. And so you've got gravity opening up the hips, and you've got also that development on tummy time, which has allowed that stretching of hips, so opening up of the hips. So as your child develops these this progression on their tummy and on their back, you'll find that in standing, their hips become more open. So you have more external rotation, so that's the turning out of the hip, and more abduction, which is legs apart. And you'll see that your child will begin to stand with support, with a slightly wider base of support, like this. And that will provide them with a lot more stability. To start with, when children are standing up, it's a very brief push-up. It's not a consistent held contraction. It's a very quick push-up, and then they'll flex back down again and push up. They won't be able to hold it for very long. And you'll also see that their bottoms stick out quite a lot. They don't have that lovely strong glute muscles, the bottom muscles there, which help to extend the hips and keep them up tall. They'll be very top heavy, so the pelvis is forward over the legs with their bottom out. They don't actually stand upright like this for actually quite a few years to come, so don't expect that. And so it's a very much a flexed position, and it's quite brief. But as they get stronger and their hips turn out and they get a slightly wider base, you'll see that there's a little bit more strength in those legs for more standing. So as your child gets a little bit stronger in this position, you'll find that you can take away some of the support around the chest and perhaps hold on to hands for support. And you'll see from my baby here that you actually need quite a lot of core strength to maintain that position in standing, because my baby here hasn't got a lot of core strength and is collapsing down. So yeah, as core strength develops and the hip strength develops a bit, you'll be able to hold your child by their hands. And they have slightly more wide base there and held by their hands. What you might see if your child is still a little bit unstable when their hands held is a position that we talked about when children are learning to sit. So to help stabilise themselves, they lift their shoulders up, arms come back, elbows extend, hands are quite flexed. So it's that stabilising position you see in early sitting when they're trying to balance. It's a fixation all around the shoulder girdle. So if you're holding your child's hands and you're seeing them pull up into this position, that's just a way of them stabilizing from your hand hold position. So again, that's all quite normal, but it's something to look at if you're seeing it in your child so that you can be aware why they're doing it. So at this point, when your child is able to have their hands held and are standing with feet on the floor, children often really enjoy this position, and once they've sussed out how to do this, whenever you're in any position, they'll often try and buoy up on their feet and be in a position, and it's something they do enjoy a lot. And if your child is having difficulty getting into that position, that's something that is really important, that you provide them with the opportunity, taking weight through their feet with support wherever they need it. We'll go into this in a bit more detail later, but it's something that the normally developing child will do a lot, lots of standing up with hands held and standing up with support. So I think at this stage, it'd be useful just to have a little talk about what's happening with your child's feet to allow them to stand. So when they're very little and just lying on their backs, we talked about how everything is quite flexed. Obviously, if you've got a child who has low muscle tone, quite floppy, then you might not be seeing this. But for those children who don't have a difficulty with postural tone, you'll find that their ankles are quite bent up to start with. And that's all part of the positioning when they come out of the womb. So early on, they're quite bent up. And as your child gets a little bit stronger, and you'll find they'll do a little bit of kicking. Just turn my baby around, wiggle back a bit. So they're doing more kicking. As they're bending their leg up and kicking down, the bottom of this foot is touching the inner aspect of the other leg as they're kicking up and down. And this is really stimulating what we call the plantar surface of the foot. So that's the bottom of the foot. Every time they're kicking down, they're getting some stimulation there. And what that does is stimulate the foot to point down. So as well as having this upward facing position, naturally, they're then developing this pointing of the toe. So this is actually mobilizing the ankle joint, because babies' ankles, young children's ankles are quite stiff. So this movement is all very normal in developing a bit of mobility around the ankle, which is what you really want to be seeing to allow standing. Also, when they're playing on their backs, we talked about development of the flexor muscles, the tummy muscles, and how you'll see that your child will hopefully be reaching up to play with their toes. Now again, this is a really important part of foot development. When children first stand up or are supported to stand up, you'll see that they really tend to claw their toes. That's again a bit like the stabilizing position. It's a way of holding on for dear life and keeping balance, so they will flex their toes. So all the flexor muscles, which are in the bottom of their foot, will be really screwed up tight, be really working hard. So in that position, they will never actually have any position which is actually elongating those muscles in the bottom of their feet. So what you'll see happening when your baby is playing and grabbing at their toes, they actually grab their big toes and they're actually pulling them forward, and that itself is actually doing a lovely stretch for the plantar surface of the foot, which is really important because you need a really mobile foot to stand on. If you've got a tight, rigid foot, it's going to be difficult. So this is all development for toes and feet ready for standing as well. Also, the hand-to-hand play and the foot-to-foot play is providing a lot of tactile stimulation for your child's feet. If you have a child that's never had their feet touched or never weight beared through their feet, you might find when they're first up on their feet, they hate it. There's so much sensory information going through that foot. It's just too much to deal with and they'll cry. So it is really important that your child, even if they're not naturally weight bearing on their feet or playing with their toes, that you're giving them lots of tactile stimulation on their feet just to get them used to that sensation. So also during the normal development on their back and on their front, your child will actually be taking weight through the soles of their feet without being in a standing position, and that's important to note as well. So when your child's lying on their back, And we talked about early rolling, where your child will bend one foot up. You can see here. So your child will bend one foot up and do that bridge into rolling. You can see there that there's a lot of weight being pushed through the bottom of that foot. So that is weight bearing through the foot, which is really important pre-standing skill. So again, if your child isn't putting feet flat on the floor in that position, then it's really nice for you to provide the opportunity for them to have bent knees and weight through feet. Also, when your child's on their tummy, so that prone development, you'll see that sometimes they actually push their toes underneath them, and when they push up on their hands. And that again is stretching that plantar surface of the foot, stretching those toes up, and really getting those feet ready for nice weight bearing. So again, if your child isn't doing that, really nice to be able to give those toes a nice stretch, because they will be doing that naturally for them if they're developing like this on their tummies. Just a note, just to talk about footwear at this point, because I know a lot of people ask if children should be wearing shoes when they're learning to weight bear or should be barefoot. Well, this depends really on your child and the challenges your child is facing. In a normally developing child, I would suggest no footwear, just so that the child will feel the floor underneath them and get all the proprioception and sensory information through weight bearing. Sometimes if your child is maybe very low tone or very hypermobile, so their feet are actually not providing a very stable base for standing, that might be an indication that footwear would be useful. And physios often provide little Pietro boots, so really sturdy little boots with sturdy soles that come up to the ankle, that just provide a really nice stable base to allow your child to work on standing and not have to worry about their foot position. So there are various reasons why we would suggest footwear, but generally if there isn't a problem with the foot, then barefoot is the best way to develop standing. But I can answer any individual questions on footwear if needed later. Okay, so let's move on with standing. So we talked about having your child, they've opened their base of support a little bit, able to have their hands held and have enough control in their trunk to stand up tall. And what you might see at this stage is the bouncing, which is again a really important part of development of standing. So what your child is learning to do is bend knees and straighten knees in a coordinated fashion. But to start with, when they're up on their feet, they will just be pushing as a mass extension, mass pattern of extension through both legs, and they'll be quite rigid. But this bouncing allows them to just flex a little bit and then push up, flex and push up. So the quadriceps and the hamstrings are the two big muscles in the front and the back of the knee, at the top of the leg that control the knee, are learning to work together. So one will contract as the other one relaxes, and vice versa. And they're learning to give way slowly with gravity as well. So that's a really important part of development. So bouncing is lovely. So holding hands, lots of bouncing is a nice developmental stage and something to be encouraged. So at this point, you've got more abdominal control in the trunk. You've got a little bit more of these bottom muscles, the glutes are working, so to provide a bit more stability in the middle. So what you'll see, your child will go from having that wide base we talked about, actually to be able to be narrowing their base a little bit, because they've got more control around here, so they can bring their feet a bit closer together. So just be mindful, if your children have got very wide bases, that is probably because their trunks are a little bit floppy, a bit low tone, haven't got the stability yet. So they're giving themselves a nice wide base. So that can be useful, but you'll note that as that gets better, their base reduces. So at this point, you might find that your child is great having their hands held, but also might be starting to practice holding onto furniture to stand. So they don't need you for support, they can hold on. So just bring this over because my table is too tall for my baby. So this is sort of surface that the child might be able to hold on to. Now, early standing at this point, you might, when you see your child in this position, they'll obviously have to be placed in this position to start with. They won't be able to get up and down in this position. Legs are very uncoordinated and sort of misaligned. And it'll be very much upper body led. So upper body will be doing all the strength, and any reaching for toys, the legs will just sort of quite passively follow. They're not actively involved in this position. So legs are quite wobbly, disorientated, might go up on tippy toes as well. So at this point, they're using all the muscles they can in their leg to stay up in standing. So you might see them go up on tippy toes, and that is quite normal. Obviously, if you've got a child with increased tone and they're on tippy toes all the time, that's different. We can talk about that later. But just popping up onto tippy toes is quite normal in this position. So over time, as your child gets a little bit stronger, you'll find that they're able to bring, he's losing his trousers, they're able to bring their feet a little bit closer together, and they're able to have a bit more control of this position and shift their weight from side to side as they reach for toys. Now, I'm not going to go over this in too much detail because this is sort of the start of cruising and walking, which is going to be our next session. But you'll find in this position, once your child can take weight through staple legs, transfer weight, you can see they will begin to do some side stepping as they're transferring their weight from side to side. And that is the start of cruising and pre-walking skills, but we won't go into that too much detail now. Now, as your child is learning to get stronger in this standing position and developing these skills for cruising, they'll also be working out how to get in and out of a standing position. So we'll look at these things as well because that all helps standing. So first of all, if we look at when your child is in a standing position and how they're going to come out of standing position. So normally, if you placed your child in standing here, they haven't yet been able to get up themselves, you just place them at a surface and you can walk away. They don't need your support. You're going to be around because obviously you know they're not safe in this position, but if you're not giving them support, what invariably happens is the child will cry because they haven't yet worked out how to get out of this position and they're stuck. So they'll cry and let you know that they need help to be taken out of this position. What will probably happen next is your child will fall onto their bottoms. And over time, this falling onto their bottoms through repetition, they will practice and practice and practice that movement, falling onto their bottoms. And this movement will become really coordinated and a really lovely movement sequence that they will use functionally. And that's how it is done, just through practice and repetition and refining that fall onto their bottom. So if we break that down a bit and see what your child needs to do to be able to coordinate that movement. So a child standing at the surface, usually it's practice when they're reaching down for a toy, reaching down for something. So your child will sort of move diagonally away from the surface. You'll find that they will then be able to open their base of support to give them more stability because they're about to transfer their weight. Usually drop their bottoms backwards. So you can see here, there's a lot of weight going through this side and you've got a bent knee and this side is extended. So it's a very asymmetrical position of their legs. And as they drop their pelvis down to the ground, they'll sit onto the floor. Okay, so I'll do it the other way so that you can see as well. And we'll go through this in more detail in the second half. So the child will move diagonally away from the surface. Just giving my child a bit extra support here. Open their base of support. Then they drop their pelvis backwards so that this side knee will bend. This one usually sticks out and they will sit down onto the floor. Okay, so that's how your child will move from a sitting position, from a standing position onto the floor. So now we want to look at how your child will get from the floor up into standing. So to start with, you'll find that your child will use you as a climbing frame to get from a sitting position into standing. So there'll be a bit of clambering going on, and they'll pull themselves up into stand on you. And that is because, without realising, you will be providing all the necessary support and guidance to assist that position. You might be sort of offloading some of the weight from the upper body to allow the legs to move. You might be naturally just changing their position, centre of gravity, so that they don't fall, and just generally assisting with that movement. And without realising, you'll be helping them develop that movement sequencing of pull to stand. That's generally how it happens to start with. Motivation, as I've said with all learned movement, is really important, and pull to stand is usually highly motivated by a child trying to reach something that they shouldn't have. So it may be a phone or food or something on a higher surface that your child is very inquisitive to find and will be motivated to pull up to stand to get. So when they've had a little bit of practice of pulling up on you, they might have the confidence to start pulling up on a piece of furniture. What is vitally important, and it will be a successful movement, is if that piece of furniture is the correct height for your child and is stable. If it's too high, too low, it won't work. But if it works for them personally at the right height and it's not going to fall over, then they'll actually be successful in carrying this out. So it's really important to have lots of different, at this stage in development, if you're working on standing, pulling to stand, have lots of things around for your child to practice pulling up on. So sofas, coffee tables, toy boxes, all sorts of different things. So they've got lots of different heights to be working on. So a child will often pull up from the 4-point kneel position. So we'll try and share this on my little fella here, but it may be easier to do it myself. But the 4-point kneel position, we'll crawl up to a surface, and then you'll find your child will reach up with one hand, reach up with the other hand, and then at this point, very much upper body led, and they'll be pulling up, but you'll find that your child pushes up both legs together simultaneously. So it's not one leg and the other leg, as your eye will get up, they push both legs up together. And again, if your child has quite a high tone in their legs, you might find this is a bit of a problem, and it's something the physio will address. But to start with, when children first learn to pull up to stand, that's what they'll do, is push up through both legs. So yeah, that's quite normal development. You might also see if there's a lower bit of furniture, so I will just move that out of the way. Okay. Lower bit of furniture. Children often pull up into stand from the side sit position. So we have side sitting here. So your child will be in side sitting, move towards that surface because there's something they really want, reach arms over, and all on the lower surface, all that body weight and upper body will go onto this surface, and the pelvis will just naturally rise up. And again, up to 2 feet pushing up. Obviously, once they're in this position, they can't use it functionally because they need their hands for balance, and if they try and play with a toy, they'll just fall over. So it is just something they will do in practice until they have more stability. But in that point, they'll just end up coming back down to the ground again. So that was the side sit. Now, a really important position to practice during these transitions is the high kneeling position. So you can see here, that's when your child is on their knees and their hips are extended. So this is a vitally important part of the getting up and getting down process. So high kneeling can be practiced a lot. You can do it on high surfaces so that the support is up here, or you could do it slightly lower so that they can prop through their hands. But what we're hoping to see here is strengthening of the hip extensors. So to start with, your child will be sitting quite far back on their knees. And what you want to do is see that hip extension so that they raise their bottom up from the back of their legs. So they're kneeling, high kneeling there. Once your child is getting stronger in that position, you'll see that they'll begin to transfer their weight from side to side. So by putting toys at various positions where they have to reach from side to side can be a really good physio practice. So their trunk gets stronger, they're moving side to side. You'll see the side they're reaching to, their side elongate on the side they're reaching to, and on the opposite side it'll get shorter. So you'll see this sort of pattern happening in the trunk. And once they can do that and achieve that, you can actually see they will be able to release one leg forward. So they've transferred their weight over to one side. This side can then be released forward. And if they have the strength in their hip, they can flex and abduct the hip to bring one leg forward into what we call the half kneel position. It's very difficult to show on this doll, so I will show you on myself. So you've gone from a high kneel position, so you're able to transfer your weight from side to side. So I can transfer my weight onto the left. I'm elongating my trunk on the left. I'm reaching for a toy there. But what I can do means this leg has been released. So if I've got the strength in my hip, I can flex my hip and bring it forwards into the half kneel position. So you'll see that's the next developmental stage, that they will go through this half kneel position. Even in that half kneel position, when they pull to stand at this stage, they won't be pushing through this leg, they'll still be pulling through arms. Arms are very much key in this pull to stand to start with. It's not till a lot later that you'll be able to see this push up through the legs. But it's nice to be able to separate those two legs out and pull up into a stand position. So we've looked at early standing, support that is needed, and how this develops into freestanding at a surface, what your child needs to get from standing to sitting and from sitting into standing. So I think I'll stop there. The second part, as always, is going to be more practical, and I'll just go through some exercises and ideas for you to be able to work with your child if they're having difficulties with standing. How you can help them achieve this. But if anyone's got any questions, obviously I haven't been specific about high tone, low tone, other difficulties your children might be having. So if you want to ask me any questions at this point, then fire away.